Bismillah ar-Rahman ar-Rahim, my dear students of Ajman University. Today we will continue chapter 5. This is part B, where we started talking about the evaluation of controlled clinical trial. It's also abbreviated as RCT, randomized clinical trials. What we completed in last topic or last lecture was regarding the title of the manuscript, the abstract, the introduction part, and lastly we talked about the methodology or the methods used in the clinical trial, or in the manuscript, let me say, which is we were talking about, or we were focusing on controlled clinical trials. Remember that the design, and that's what we talked about in last tutorial or last video, the design should be suitable to the objective of the work. Okay, so if you are attempting to see the efficacy and safety of a drug, the best design of research is not in vitro test, for example. It should be a controlled clinical trial. But if you want, for example, to determine the shelf life of a formulation, how stable it is, then you will not do that as clinical trial. You will do it in vitro to look at the stability of the formulations. فإذا the objective of your work should be matched with the best design that is possible, taking into account that this design should be also addressing ethical issues. For example, let me say, you cannot say, okay, I want to prove that cigarettes can cause cancer, so I want to get a group of people, I want to recruit subjects, then I will divide them to two groups. One group will be smoking 20 cigarettes a day, and the other group will not be permitted to smoke, and I will follow them for 20 years to see if a cancer will develop. This is unethical, of course. Today we are going to start with patient inclusion and exclusion criteria. Now this is determined prior to recruitment. Yani before you recruit your subjects, you must list the criteria that should be available or present in your subjects in order to get in, and also you should list the criteria that prevent them from enrollment into the study. Remember that the exclusion criteria will be also applied if such criteria or criterion appear even during the study. For example, in my exclusion criteria, and this is usually the case, I will exclude women who are pregnant or lactating women or nursing women. So if a woman gets pregnant during the study, then I have to withdraw her or remove her from the clinical trial. So exclusion criteria is applied for the subjects that want to get into the trial, and if they met the inclusion criteria and the exclusion criteria were not there in them, and later on these exclusion criteria develop, then I have to withdraw them from the study. So what is inclusion criteria? It's demographic, the demographics of the subject: age, sex, status, pregnant or not pregnant, etc., hypertension, diabetes, etc., that should be present, okay, in order for us to accept this subject into the trial. While exclusion criteria, these are characteristics that prevent the subjects from enrollment into the trial. Okay, now the thing is that you need to be aware that when you list these criteria, before recruitment, they have to be clear. For example, I'll give you an example. Let us say that we have a hypertensive drug or drug that is used in the management of hypertension, and I need people that are hypertensive. So my inclusion criteria is people diagnosed with hypertension, for example. But this is not enough, because you should list the diagnostic criteria for that. You should say, for example, they should have a systolic blood pressure of at least 140 and diastolic blood pressure of at least 80 to be enrolled, مثلا. Okay, so you need to be clear in your criteria. Another thing to mention here, because I found this, or some students, they use this. For example, they will say, okay, my inclusion criteria is for the subjects to have at least a systolic blood pressure of 140 or more. Okay, and then when they go to exclusion criteria, they say my exclusion criteria is for subjects having systolic blood pressure of less than 140. Now this is repetition. It's not correct. You cannot do that. Okay, your exclusion criteria must be different. طيب, for example, I can say, okay, my inclusion criteria is a patient with hypertension. Okay, and I specified, or I described what do I mean by hypertensive. Okay, and then having one or more accompanied comorbid يعني diseases. Okay, so other diseases, they have at least other diseases along with the hypertensive. So I cannot go to the exclusion unless I say if they only have hypertension, then I will not accept them. Okay, so the exclusion should be different, and usually we include characteristics such as pregnancy, terminally ill patients, those with severe kidney problems or liver dysfunction, because these things can affect the trial results. Okay, and we don't, when we do comparison between the two groups, the only thing that should contribute to the effect is the drug. I don't want anything, for example, kidney failure or liver dysfunction, to also influence the results. طيب, usually it's a difficult decision to make when we list the inclusion and exclusion criteria, but in general we should always think, and this is the ideal case, we should always think about the population having the disease condition. For example, if I'm thinking about hypertension, then I cannot say, okay, I will take people only having hypertension without any other disease. I cannot say that, because many people who have hypertension, they have other conditions as well, such as, for example, diabetes. Okay, so I have to know my population, the population with hypertension, what are their characteristics, body weight, lifestyle, etc., etc., and based on that I can list the criteria, so that my sample that I will take from population can be representative. Okay, and this is very important, because if your drug is really effective in this representative sample, then it can be applied externally. The results of the clinical trial can be applied if your drug is successful. It can be applied to the population. So external validity, if you remember. Okay, so you have here external validity. Okay, the results are there, the drug is effective. Now the practitioners, they want to apply these results, they want to use the new medication, but they are having problem because maybe in your inclusion criteria the subject demographics and characteristics are different from what the practitioners are used to. Okay, so normally subjects recruited will have maybe one or more accompanied diseases, but not so many. Usually we do not include, for example, terminally ill patients, people with cancer, women, pregnant women, lactating women, okay, people with so many diseases that may affect the results of the trial. So we usually exclude them. طيب, now selection bias can be present. Okay, let's say, and I will assume the following, that you did a good listing of the inclusion criteria and the exclusion criteria. Everything was going good, but then for some reason after recruiting them you removed some subjects. Okay, you did not like some subjects, فهنا راح يصير عندنا selection bias because they met the inclusion criteria, but you removed them. And you removed them, why? This is the big question that can really tell you whether there is a selection bias or not. For example, many trials, they will have what we call, this is important, okay, it's called run-in phase, or it's also called lead-in phase. Okay, so if you see that there is run-in phase and lead-in phase, open your eyes, be vigilant, because there may be a selection bias. Okay, not for sure, not every trial with run-in phase it means there is selection bias. Like, what is this run-in phase or lead-in phase? It's a period of time, usually ranging from 2 to 4 weeks, and that is before the official clinical trial starts. Okay, officially we start with the subjects. Now in this 2 to 4 weeks, what they do, they may, for example, and here is or maybe you have a selection bias, so pay attention. I'll give you an example. Let's say I have a hypertensive patients, and I'm having a drug for that, and before the subjects start the trial, I want to give them this medication, okay, to one of the group, because I have 2 groups. Okay, so I'm giving one group the drug, and I want to see if there is any safety concern or there are side effects on them. I want to remove them from the trial. So I'm looking at whether the safety of the drug is good, that they can continue or not. طيب, so when I did that, I had to remove some subjects who had bad effects or side effects that required them to be removed from the trial. Okay, طيب. Now what happens after that? You started your clinical trial and everything looks good. No, now there is a problem, because in this case you are ignoring the safety issues, and you removed some people that if they were present, either they continued with the trial and they started the trial, they may negatively affected the results. But what you did is you removed them, and when you removed them, the results became better looking. Okay, so here we have a kind of selection bias, that people, although they met the inclusion criteria and they did not have any of the exclusion criteria, but then you removed some of them because of side effects before they started, and you did not report that. So what should have happened in this case? Okay, what should have happened is that they should have included those people in the results and assume that they are failures or there is safety concerns regarding them, so their results should have been included. Okay, but sometimes selection bias is not there. Okay, for example, I'll tell you an example where there is a run-in phase and there is no selection bias. طيب, another example, okay, also for hypertension, I'm recruiting some subjects, okay, they met the inclusion criteria and none of the exclusion criteria were present on them. طيب, after that, your aim or your goal of run-in phase is, if they have taken any medication for hypertension, you want to wash that out. So you are giving them placebo. You are asking them to stop their medication and giving them a placebo. The reason why you are doing that is not to exclude or remove or withdraw some subjects. No, your aim is just for the prior or previous drugs to diminish from the system. Okay, so you have that one. Another example of lead-in phase where there is no selection bias is that, for example, I'll give you another example. Let's say, and you have this example here, let's say you have aspirin. Okay, aspirin. Now aspirin is prescribed for some patients, okay, and because it's blood thinner, so it will prevent blood clotting. طيب. Now, so you wanted patients who are taking aspirin. This is in your inclusion criteria. طيب, once they are in your trial, your goal was you wanted to see if those who are having aspirin, okay, and then you give them a proton pump inhibitor such as esomeprazole, will that reduce the bleeding, GI bleeding? Okay, isn't you want people who have bleeding because they are taking aspirin, okay, and those people you want to see if you give esomeprazole, this will reduce the problem or help the case, or if you change aspirin maybe to another drug like very well-known drug, antiplatelet agent which prevents clotting, اللي هو clopidogrel. Okay, so can they continue with aspirin and take esomeprazole? Will this be beneficial, or they should switch to clopidogrel? Because these drugs can because they are blood thinners, they can also cause bleeding, but aspirin can cause bleeding because of direct effect on the stomach. Aspirin is acetylsalicylic acid, and it's an acidic, irritating the stomach because it's non-steroidal anti-inflammatory drug, and all those drugs, they irritate the stomach and may cause bleeding. Additionally, it's blood thinner. So you have two things here. So take aspirin plus esomeprazole, or just take clopidogrel. طيب, that's why when they recruited subjects who were prescribed aspirin, they did not enroll them directly in the trial. What they did is they waited to see whether those who are taking aspirin and having GIT bleeding or gastrointestinal bleed, only taking them, while those who are okay with aspirin and there is no bleeding, okay, they are removed from the study, because the focus of the study was to look at subjects who are taking aspirin and bleeding. This is their subjects. This is what they want to look at. Okay, فإذا the run-in phase here, where they are waiting to see whether there will be bleeding or not, is not considered as bias clearly, because their aim in the beginning is to recruit subjects that after taking aspirin will be bleeding and then involve them in the trial. So you have to be aware of the possibility of selection bias, especially when there is a run-in phase or lead-in phase. طيب, how subjects are recruited. يعني let's say there is a clinical trial and it's requiring subjects. How this can be done? How they can be recruited? طيب, usually the sponsors اللي هي usually pharmaceutical companies who are paying the money, they will offer financial incentives to investigators to increase on enrollment. In order to make the investigators enthusiastic about getting more subjects, they will give them incentives. They will tell them, for every subject that you include in the trial or recruit to the trial, you have $1,000, for example. So those sponsor, those investigators, what they will do to increase enrollment, they will target their own patients. مثلا, someone cardiologist, he will start asking his patients who have hypertension that there is a clinical trial, there is a new drug and it's promising, why don't you get enrolled? Or what they will do is they will go to, or will ask other physicians to refer their patients to the clinical trial, okay? Or they will go to the disease registries. For example, in USA, you will find a registry of people with diabetes, registry of people with hypertension, etc. So they will go to these registries and they will contact them in order to ask them to be in the trial. Also, they advertise, and in the advertisement, you have the newspapers, you have the radio, you have the internet, you have the television, you have posters that they put on public places and in hospitals. طيب, but you have to be careful regarding recruitment using some of these media, okay? For example, if you advertise on the internet, you don't expect someone who's 80 years of age to go to the internet and search for such clinical trial, okay? And actually they found that people who use internet, they are younger in age. فمعناته here there is a problem of selection bias, okay? Because instead of targeting all people who might have the disease, you are the age is an influence here. You are, for example, if you are using internet, you are targeting younger people, okay? Also the newspaper, they found, for example, there is gender bias that can happen if there is an advertisement on the newspaper. For example, they found that those who read the newspapers are primarily, هذا في USA, okay, they are Caucasian, يعني white people. They are wealthier, they have good money, good lifestyle. And another thing طبعا هنا معناته صار في اللي هو الريس. We have race bias. Also there is a gender bias because they found that female appreciate or they are interested in advertisement that are on the newspapers more than male. فبالتالي those who are probably will look at the advertisement are female subjects rather than male subjects. فإذا هنا we don't have equal opportunity for them to participate, okay, and we might have what we call gender bias. So you have to take all that into consideration when you want to advertise for the clinical trial. Okay, now we will talk about intervention and control group. Specifically, I'm talking here about the drug, the therapy, the investigational therapy that you want to use and the control that you want to use. One of the most important term في الكنترول clinical trial انه it's controlled. Okay, so in addition to the intervention group, okay, which consists of investigational therapy, you have a control group, and this control group can have either no therapy يعني placebo, or it can have another therapy also known as active control. إذا لما يكون في هناك another therapy we call it active control, which can be drug, exercise, lifestyle, or something else. Or maybe, and this is in rare cases, instead of having another group of people having the placebo or other medication, etc., you might depend on historical data. يعني you might go 4 or 5 years before this and start collecting data from previous years. So this is your control. Okay, طبعا this has some advantages and disadvantages, and we will talk about each one of these. طيب, placebo. Why we would first of all, why do we need a control? Why don't we, for example, يا زينب ويا سارة ويا تولين, why don't we just recruit people, okay, with hypertension, okay, and I have a drug for hypertension, see what is their blood pressure, start giving them the medication, and at the end measure their blood pressure and see whether there is a difference between initially baseline and at the end. Okay, طبعا scientifically this is not proper. Okay, they tell you that this may be by chance or falsely quantified. يعني maybe there are other reasons why their blood pressure has reduced. Unless you have a control, then your results will be weak, and you cannot just compare the baseline with the measurements that you take after that. Okay, so in order to prove that your drug is effective and measure this effect, you need to have comparison. Okay, you need to have control group. Now, as I told you, placebo is one of the control groups, and let me talk about that, and then I will go back to historical data. First, why placebo? And this is an important question. The reason why we do placebo or we use placebo for control is this is a requirement by FDA. طيب, the question is why FDA requires you to use placebo. They tell you that in order to market your drug, you need to have or to provide two important things. First, you need to say that your drug is effective, and second, you need to say that your drug is safe. Okay, and these two things. They tell you in order to do that, in order to say it's safe and effective, you must have placebo. Because if you have another drug, then you might not find a significant difference. Okay, if there is another drug, there might be no significant difference between the two drugs, and this is not proof. Remember this statement that I will give you. You can prove the difference, but you cannot prove the equality. Okay, this is very important. You can prove ايش difference, but you cannot prove equality. This is the work of statistics. This is how statistics are made. So you can prove that there is a difference, and in this case you need a placebo to show that there is a difference, but you cannot prove similarity if two drugs are You cannot prove equality if two drugs are providing similar effect. That's why FDA tells you if you want to prove that, you have to compare it with placebo. Okay? طيب, what's the problem with placebo? First, if your drug is better than placebo, then you don't have evidence that it's better than the drugs that are in the market. صح? Because what you proved is that it's better than placebo. Okay, it's effective. But why prescribers, okay, need to change the drug they are using for their patients? They tell you, well, you don't have any proof that it is better than what I give to my patients. فإذا you don't have or you are not able to determine what is the place of your drug بالmarket. Another thing which is bad about placebo, that if the patients know that they will be taking placebo, okay, this might affect them by making them non-compliant. يعني if I know that I'm taking placebo, why should I be compliant? Okay, I'm taking nothing. Okay, and it will reduce their willingness to participate. And I will give you a personal example. Okay, personal, it's with me. You remember that maybe before 7 months or 8 months, they had in UAE clinical trial about the Chinese vaccine for COVID-19. Okay, and I was so enthusiastic. I said, okay, why don't I go and just take the vaccine? I'll be the first. But when I went there, I asked myself, if this is a controlled clinical trial, which was phase 3, if this is a controlled clinical trial, then it means that I might be taking placebo. Okay, not only that, according to the protocol, they will need me to come and take blood samples, and they will continue calling me to see if I have any side effects. So why should I participate? But I said, okay, let me ask the guy on the counter, let me ask him and tell him if there is a placebo. And he confirmed that. So I decided, I wasn't willing to go and take the vaccine because maybe I will be taking placebo and I will not benefit from that. So giving placebo, one of the disadvantages that it will decrease willingness of the subjects to participate. Okay, now let me go to the historical data. A few clinical trials might tell you, okay, I will compare my group with data I have from the history, يعني reported previously. This can be acceptable in certain cases. For example, this is one, okay, when there is a rare disease, so you cannot actually find many subjects to try on because it's rare disease. Number 2, it's suitable when there is a lot of morbidity, يعني a lot of death. يعني if I don't try a drug with the patient, he will die. Okay, so I have to try a drug. So in such cases, maybe it's having certain advantages. طبعا, of course, I'm only using one group, so it's cheaper for me to conduct the trial and less time, etc., etc. Of course, there are disadvantages, and these disadvantages include, there is no guarantee that there are similarities in the subjects you recruited and the subjects that you took data from them historically. Okay. Also, usually the results are overestimating the effect of intervention. Okay. فإذا can be acceptable, yes, but you have to be careful about that. The other type of control, as I told you, is the active control. And here you have to pay attention. If I compare my drug with something that is not the first line in the treatment of patients for hypertension, for example, or for cholesterol, I treat it with something inferior. يعني already the prescribers, they don't use that therapy as a first line. Okay, so if I prove that my drug is better than the drug that is not really used by prescribers, then I will not benefit if I say that my drug is better than that. I have to compare my drug with the best, with the first line treatment that prescribers use. And if I prove that my drug is more effective or more safe, then this will allow me to convince the prescribers that they should use my medication. Okay, so standard therapy here is important. Not only that, but you have to pay attention that this standard therapy must be given in the right dose, in the right formulation, okay, in the right frequency. Because if you fail in any of these things, you are wasting your time. For example, in one of the trials, they compared carvedilol with metoprolol for hypertension or heart failure. Okay, they compared both medications. But when they did this comparison, there was another formulation of metoprolol coming up to in the market, and it has been proven to be better than immediate release formulation. So there was a new formulation coming out. But what you proved that carvedilol is better than immediate release formulation, but you did not prove that carvedilol is better than the extended release formulation. Okay, so again you are losing here. So dosing frequency is very important. Another thing which I will let you also for you to understand here when you do a comparison with an active control is, for example, rovastatin, which is a statin drug, was compared to atorvastatin. طيب rovastatin مع atorvastatin, both were given as 10 milligram once daily for 12 weeks. For those who did this comparison, they found that rovastatin is better. There is a reduction in cholesterol level by 43% compared with 35% in atorvastatin. طيب, but there was another trial which used 20 milligram of atorvastatin, okay, compared to 10 milligram of rovastatin, and they found that there is no difference. So when I increased the amount of atorvastatin, there was no difference. Isn't I have problem here with the dosing. طيب, isn't what is the conclusion of this trial should be? A more appropriate conclusion, when I compare 10 gram each atorvastatin مع rovastatin once a day, both were the same. شو لازم يكون conclusion? What should be my conclusion here when I say 43 and 35? The more appropriate conclusion should be that these two agents do not have an equivalent pharmacologic effect on this dose. بهذا الدose they are different in effect, but I cannot say one is better than the other. Okay? Okay, Institutional Review Board and Subject Consent Form. Now, before you start your clinical trial and before you recruit any subject, you should apply for ethical approval. This ethical approval is applied to the place where you want to do your trial, for example, hospital, university, etc. And there will be a committee in the institution or in the university or in the hospital, which is referred to as ethics committee, or sometimes they call it institutional review board. It can have different names: institutional review board or ethics committee, or might be something similar. So this committee, they must approve the study before investigators begin enrolling subjects into the trial. Their main job, okay, is to ensure that the subjects are protected, the people that you are recruiting will be protected, and they are not exposed to unnecessary harm. Okay, that is their main function, but they have other functions as well. And this committee is usually consist of not only healthcare providers, professionals, they should also contain non-healthcare professionals. Someone will tell me, شو علاقته? What's the relation of non-healthcare professional? Their job, for example, you might include lawyers, you might include lay people from different profession, because they need to understand, as lay people, they need to understand whether the recruited subjects will understand what you are telling them. And that's where you have what we call subject informed consent form. Each subject that is recruited into the trial must sign this form to be recruited into the trial. If the subject does not sign, he will not be taken into the trial. So in this form, في هذا الform, you need to explain to the patient, but the patient most probably is not a healthcare professional. He's a lay person, and he needs to understand what will be happening. He needs to understand the study procedure, his rights, his responsibilities, including at least 8 major points. What are the risks for him? What are the benefits? What is the compensation? And his right to withdraw, and that his participation is totally voluntary. No one should be forcing him. IRB will need to approve this. Okay, and in our university, Ajman University, we have the ethics committee, and if you are going to do any even survey, questionnaire, you want to talk to doctors, you want to talk to pharmacists, you need to have this subject informed consent form prepared. Okay, and you need to get ethical approval before you can start your questionnaire or interviews. طيب, IRB provide investigators with suggestion on how to write. For example, that's why here you have non-healthcare professional. They will tell you, okay, you have here a statement about the procedure, but I don't think the lay person will understand what you are saying. So they will give you suggestion on what to write. And what are the functions of IRB? Approve clinical trial, approve patient informed consent, help in writing subject informed consent. Okay. Blinding. It comes from the word blind. Blind means I cannot see. But what does it mean? For the clinical trial, what does it mean? It means, see, I'll give you a situation. If there is a drug for depression, yani someone is having depression, so I'm recruiting subjects with depression, and then I divide them to two groups. I give one group the active drug, the active constituent, and the other group I give them the placebo. if I tell the groups that you are taking the drugs and the others are taking the placebo, if I tell them that, and then I want to report whether their depression symptoms have improved or not, surely اللي ماخدين placebo they will tell you no, it's worsening, صح? Because they know they are taking placebo. And actually they found that when there is no blinding, okay, there is influence on the results, okay, especially subjective results. طب شو يعني subjective results? Okay, I'll give you an example. If I want to measure cholesterol level, this is not subjective, because you will take blood samples, and the blood samples, after analyzing them, they will tell you what is the cholesterol levels, right? So this is objective. But when I say, okay, I want to assess whether the drug relieve pain, you are suffering, you have pain, and I want to see whether it reduces pain, then for sure, if you know you are taking placebo, you will say it did not improve. You are not going to say it improved, okay? And this is, we call it subjective outcomes or measures, okay, such as pain, depression, things like that. But the question is, does it mean that if you have a drug for cholesterol, okay, and you want to see the effect of the drug on the cholesterol, does it mean that you don't need to do blinding? The answer, no. Still you need to do blinding. But why? Cholesterol is objective measure. So why do I need to do blinding? And the answer is, when you do a clinical trial that costs maybe millions of dollars, okay, you are not only going to measure blood cholesterol level, you will be looking at safety, okay, like for example constipation, pain, frequency of stool, urination. So there are many other things you will be looking at, not only cholesterol level, okay? So most clinical trials, they will determine the number and the severity, يعني how bad it is, okay, in the safety area, okay? So these clinical trials will need to include blinding, and blinding means that the maybe the investigators and or the subjects receiving the treatments are not aware of their assignment, whether they are in the active or they are taking the active drug or the placebo. Now there are three types of blinding, and I will go through them here and talk about them. One, there is no blinding, we call it open label. طبعا they found that open label or no blinding usually overestimates the effect of intervention, okay, and it's not recommended. But sometimes they do it. Sometimes they do it because they cannot do otherwise. يعني if I'll give you an example. Let's say I want to compare a therapy, okay, a treatment with surgery. Is in one group will be having surgery, one group will be taking the medication. I want to see which one will be better. طب can I do blinding here? If I want to do blinding, what will happen? The people who are taking the medication, the drug, I need to do imitation therapy for them, fake therapy, imitation surgery for them, or fake surgery. يعني I will cut, I will do incision and I will do cutting. And the other people, I will give them, in addition to surgery, I will give them a placebo, okay? That's how I can hide things. And you know, to do a surgery on the patients that are taking the medication is not ethical, because you are subjecting them to unnecessary harm. So in this case, I will do it open label. Single blinding is when one of the parties, whether the investigators or the subjects, but not both, okay, are aware of the assignment, whether it's in the intervention group or control group. And this can happen, for example, as a precaution. Okay, for example, if I have an injection which is given for blood thinner يعني, okay, to prevent clotting, an injection, and the other one is given also for as a blood thinner as tablets. فإذا I have injection and I have tablet. طيب, if I give also injection to the tablet, to the one who's taking the tablet, okay, then this can have consequences which include bleeding. Okay, so I cannot just give the subjects that are having tablets, I cannot give them injection because they might encounter bleeding. So I need to know which one is taking what. Okay, or the patients needs to know if they are taking taking the drug as tablets or as injection. The gold standard, and this is applied in almost or in most of the clinical trial, is هو بنحكي له double blinding. هذا in most clinical trials you will see this, and in this case both the investigators and subjects are not aware of the assignments of the subjects, who's taking what. Okay, now someone will tell me, then who's aware? I will tell them after the controlled clinical trial is done and everything is complete and they have analyzed the results, then they will disclose, or they will know the assignment for each one. يعني all what they know is the results of subject A, B, C, D, E is in one group. The results of subject D, E, F, G, H مثلا in another group. But they don't know if this group is taking the drug or the other group is taking the drug. They don't know this. And once they finish the trial and they do the analysis, then they will open or they will disclose which group was taking the drug. Now, triple blinding, this is like a new one, or it's not like a new one, it's like a different thing, in order to assure the readers that everything was done properly. Now, you know, I can be an investigator and you can be the one who collects the data. Okay, I am investigator and you are collecting the data. Okay, for example, you are administering the drug, you are measuring the blood pressure. So myself as investigator and you as the one who's collecting the data, you are not aware if this subject is taking the placebo or the drug, and also the patient is not aware. So you have the patient or the subject is not aware, data collecting personnel, they are not aware, investigators are not aware, so no one is aware of who's taking what. Now in this case they refer to it as triple blinding. Okay, طيب, what if I want to compare a drug, this is treatment A, drug A which is given as tablet, with drug B that is given as capsule. Okay, how can I compare between them? Okay, while doing the blinding, because you know, if it is known who's taking the tablet and who's taking the capsule, then there will be no blinding or open label. So how can I keep it as a blinded trial, double blinding, اللي هو the gold standard? How can I do that? Well, what we will do is, for the person who's taking the medication A, okay, this medication, I will give him a placebo capsule. And for the patient who's taking the medication B as capsule, I will give him a placebo tablet. And what is this process is called? It's called double dummy technique. شوفوا, in this one I gave a dummy, and in this one I gave a dummy. Okay, and we refer to it as double dummy technique. So it's a method that are included in clinical trials when two therapies being compared are not equal or the same. Maybe different routes of administration, different dosage form or formulations, etc. Okay, now we will talk about randomization, and here there is something important for you to know. The question is, okay, I have, let's say you want to do a study or a project in your final year, and you want to know, how do I do randomization? And randomization means that each subject has equal chance of getting into any of the two groups. Okay, يعني I need to make two groups. هلا I recruited the subjects, now I want to put them in two groups. Now each subject should have an equal chance. Okay, and randomization will minimize bias, because if you, for example, if you as investigator, if you do the division, the assignment to group A and B, then you might put in your group intervention that will take your therapy, you might put people who have better prognosis. Okay, يعني it's predicted that they will respond better to the drug. They do not have a lot of comorbidities. Okay, يعني many disease, so you put the people who might respond. So in order to avoid bias, you need to do randomization. And here we will talk about different randomization technique, and I will explain it to you. The first one is the symbol randomization. Okay, before I talk about symbol randomization, just let us focus on that. I want in the two groups, I want to have equal number of subjects, رقم واحد, and this is the case usually. Number two, I want to have the risk factors, يعني مثلا age, sex, etc. These risk factors, they should be balanced in the two groups. يعني I don't want to have more hypertensive patient in one group than the other one. I don't want to have more female in one group than the other group. Okay, so I want to balance these things. This is also something that I have to consider when I want to do randomization. The first, as I told you, type of randomization اللي هو simple randomization, and sometimes simple randomization is not good enough. It can be done by computer programs, for example. Okay, or you can use a coin. Okay, and for each one, if it is tail, then he goes to group B. If it is face, then he or she goes to group A. You can do that, but maybe here you will have imbalance in the number or in the risk factors for two groups. يعني maybe more face will be because you are tossing the coin and you have more face coming up, so you have more in one group. Also, if you do that, you might have more hypertensive patient in one group than the other one. Okay, طيب, this is simple randomization. Another thing is, for example, you say, okay, those who are recruited on Sunday and Monday, I will take them in group A, and those on Monday and Wednesday, I will take them to group B. But again, this is can create imbalance in the number and in the risk factors. طيب في عنا computer programs, and I will show you how to do randomization using Excel. You know Excel? Okay, now you can do that using Excel, where you generate a number for each participant, and this number generated is a random number, and then you can divide them based on their ranking. Okay, I will show you how to do this in Excel because it's beneficial to you, and then I will talk about the other cases. طبعا here I'm talking about simple randomization. طيب, let me say I have the following subjects recruited. I have عبد القادر, أديب, أحلام, أحمد, آمنة, آية, بتول, Dina, Haneen. So I have subjects as you see them here. Okay. طيب, there are 52. So what I need 26 in one group and 26 in another group. Okay, see what I'm gonna do. First, I will go here and I will type equal to and then rand. Okay, see, it's here, rand, and just close the bracket. See, it's generating number, and this number is from 0 to less than 1. Okay, طيب, I will do this to others. So I'm gonna, طبعا this is random number from 0 to 1. Now I will take it to others. Okay, see, everyone has a number. شوفوا, عبد القادر is first, أديب second, أحلام third. Okay, now what you do is you copy these number, copy them, and paste them again here as numbers, because now they are formula, so you have to paste them as number. هلا بطلوا formula, بطل equal to random number. Okay, so I took the same numbers that I got, I just pasted them as numbers. طيب, see what I will do now. I will ask Excel to arrange them according to the number, ممكن from the top to bottom or from the bottom to top. So I will highlight these two. Okay, now I highlighted them and I go to filter and here custom sort. Okay, here tell me, do I need to do it by Abdul Qadir? No, I will tell him do it by the second one, but because there is title, so I have to take it from the title. I'll write here number, random number. Okay, now I will do the custom sort. Again, it's giving me Abdul Qadir. It has to give me the title, so I cancel it. Okay, I'll take it with the title. أيوة, هيو name. بقول لي do I sort it by name؟ لا, ما بدي. I don't want by name. I want it by the random number generated. From the smallest to largest or largest, you can choose if it is from largest to smallest. Okay. شوفوا صار عندنا مين؟ ربيح أول واحد, مهرة second. So I can take the first 26 اللي هم هدول. Okay, these are 26, and I can say, okay, I want to put them in group A. This is my group A. Now the next after Abdul Aziz is the next group, and this will be my group B. ليش مش why it's not the same? have to be equal. Okay, 26. Okay, here 26 لحد عمر. لا مش لحد عمر، لأنه بادئين we started from 2, so we have till عبد العزيز. Okay, again هنا B, group B, from Minnatullah going down to Mayar. Anyway, strange. Why something is missing? Okay, so this is the way you divide them to two groups. I'm sure يعني في هناك something I missed, but anyway, so now I have two groups and I can make them equal, okay, based on the generated number that you see here. Okay, طيب, so this is a simple one, and in this case بالcomputer program I was able to divide them to equal, which is one of my goals. But you know what is the problem? Maybe here you have more male than female, بينما here you have more female than male. This is the problem. Or in another word, maybe you have problem with you have problem with the risk factors, يعني factors that might affect the results. Okay, so I have problem with that one. That's why I need more sophisticated way to deal with that. So simple randomization might not be good enough. I need to go to something more advanced. What is more advanced? More advanced is stratification. And for stratification to be useful, I need to do it along with blocked design. So stratified, blocked, in order to have equal number of subjects and equal distribution of risk factors in the two groups. I cannot use simple random. I have to use sophisticated techniques such as stratification. But in order for stratification to work well, you need to do it along with block design. So how you do that? You need to ask your question. Okay, in this case, the case I have here, okay, the case I have here, you know why I have, now I got it, because I have 51 and not 52. So I have 26 and 25. It's okay. See, this one number is not, we can still consider them to be equal or very similar in number. طيب, now I have to ask my question, I have to ask myself a question. What is the important thing that might affect the results? For example, let me say the following. Okay, female student tend to like pharmacy more than male students. I know this fact. So if there is more female in one group, it will show me that they like pharmacy program more than the other group. So what do I need to do? Okay, I need to stratify. Stratification means making them as layers. Each layer will be homogeneous. Okay, so in this case my layers will be male and female. Okay, these are, I'm not going to compare group A مع group B. لا, I'm just dividing them. I'm making them stratified or strata, يعني طبقات, جاي من stratum, layer. Okay, so I'm making them layer depending on the risk factor. My risk factor here is the sex, male or female. Okay, it seems here, but how here I have maybe I have a similar name. anyway doesn't matter, this is not the idea. طيب فإذا now each one شوفوا من هون from this one I will take half of them and I will put them in group A and the other half I will put them in group B. طيب how can I take half? I need to make it random. I can repeat what I did here. I can say equal to random, and now I close the bracket, and now I will get random number. Now I will make to all of them, then I will copy it and will paste it again here as numbers. You cannot just keep it as it is with the formula. You have to change it as number, and then I will say okay, now I will sort it, no, I have to take it from the top here. شوفوا Wasim is the first and then Muhammad. Now see what will happen. Column K, and from the smallest to largest or largest to smallest. Okay, see now Umar is the top, so I'll take the first half. Okay, this half I'll put it in this group and the other half in the other group. Okay, غريب نادر. Anyway, it should be equal or at least very similar. Okay, it doesn't matter. طيب, now what about female? Again, I will do the same thing for female. I will say equal to rand. See, it gives me a bracket. I have to close it and then do it like this, then copy it, then paste it as number. And now what I will do, I will arrange it according to number and from the large to small. Okay, I will take half of that, or about half, let's say 12. I'll put it in this group, or let me say 13 أحسن عشان okay, I'll put it in this group and then the rest in the other group. Okay, طبعا maybe I didn't take them equally. I can change that. Okay, again from 2, these are 26 يعني 25 يعني 12 يعني 13 أو خلينا نحكي okay, I'll put it in this group. Oh wait 1 second, I'll put them here and the rest is here. Okay, as you see, I'm sure they should not be exactly the same because they are 51. Maybe I did a mistake anywhere somewhere here, but in any way, this is, by doing this, I made sure that there is almost equal number of each risk factor in each group. So I have here similar percentage of boys like in this place, and similar percentage of girls here like in this one. Okay, so when I do the comparison, who likes the pharmacy program more or who likes drug information and literature evaluation course more, the answer, I can compare them while feeling that the risk factor is the same in both sides. طبعا here as I already explained, I divided them according to sex. I can divide them also according to GPA. Maybe those with higher GPA, they like the course more, and with lower GPA, they like the course less. Or I might divide them according to the attendance rate. Those who attend the course more, they like the course more, and those who attend the course less because maybe they don't like the course. Okay, so you need to identify the risk factor and then do that. Now, okay, they tell you, okay, this is good, but in this case, there is another way to have what we call block. Okay, block can ensure that similar number of subjects will be in each group. I used computer program, but otherwise you might use what we call blocked design. block يعني I have to divide things to block. يعني each of these stratum, كل طبقة منها I will divide them to block. For example, what is the size of the block? The size should be even, and it should be at least 4 and even. It can be 4, 6, 8. The higher the better طبعا, but it will be more complicated. So we will go for 4. So for example, I can say, okay, one of the ways is the first 2 goes to A group and the second 2 goes to B group. طيب بعدين BB AA, AB AB. Okay, so each block size of 4. ترتيبهم انه the first 2 goes to group A, the second 2 goes to group B, وهكذا. Okay, طيب the second after that BA BA. طيب ايش كمان عندنا؟ AB BA BA BAA B we A B A. Okay, I have 6. Okay, so I have 6. طيب I will take each one of them and I will put them in each stratum. I will distribute them. شوفوا هون. طيب let me count these. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 21 22 23 24 25. 25 معناته كم من هدول بحتاج؟ 4 8 12 16 20 24. محتاج كمان واحد, right? طيب I will just randomly pick A B A B. Okay, طيب the first 4 1 2 3 4 will take this one, but maybe I did not do this randomly, so again I can random this one. Okay, can make it random. Now I will arrange them. I will sort them according to group F from the highest to the smallest. Okay, شوف هاي خربط لي اياهم. Okay, now I don't need this one, so I can say, okay, the first 4 will take this. ايوه 1 2 3 4. Okay, عند يوسف. بعدين عمار 1 2 3 4. now سمير. Okay, طيب بعدين سمير محمود سامر نادر ياسر. Okay, after that ياسر بشير. Okay, my name is here. اوكي بعدين after that اديب حازم داوود عبد العزيز عبد الله. اوكي عبد الله. Okay, now we done it. So what happens here? You say Umar goes to B, Wasim goes to B, group B, Muhammad goes to group A, Yusuf goes to group A. How did I know? From this. Okay, Ammar goes to group A, Ayman group B, Mustafa group A, Ahmad group B. طيب, for this one, Samir group B, Mahmoud group A, Samir group A, Nadir group B, and so on. Okay, this we do also similar things for the female. So in this case, what we did stratification, okay, and then we did blocked stratified, okay, stratified and block design. Someone might tell me, if we go here to Suhail, someone will tell me, what about Suhail? Suhail will go to group A according to this one. معناته we will have more male but by one يعني, and it should not have a big effect on the results. Suhail will go to group A. Okay, so we'll do similar thing for group B. Okay, this is just to explain to you what we mean by block design and stratification. In order to have the same number of the subjects in each group, we need the block design in each to distribute and to make the risk factor balanced. In this case, we need stratification. فإذا stratification and block design will ensure these things. Okay, now we will talk about endpoints. Now there are many different types of endpoints, and you need to be aware of the terms that are used. Now, what is the objective of the research? You should remember it, because the answer of the objective of the work involve the primary endpoint. For example, if my objective is to see whether my drug can reduce cholesterol level, this is my objective, then my primary outcome will be cholesterol level. Okay, and this is called primary outcome. This is the main thing. This will answer the question. This will answer the main thing. And this is very important because the sample size is based on the primary endpoint. Okay, but of course you know that you are doing a clinical trial, and this costs a lot of money and takes a lot of time. You need to measure other things that may be necessary, and we will call them secondary endpoints. And those that will not answer directly the main question of the clinical trial, we will call them secondary endpoints. مثلا, as I told you, in cholesterol level, your endpoint will be the value of cholesterol level. Okay, if you are trying to see the effect on heart failure, okay, I cannot choose creatinine, for example, as endpoint. Creatinine, you know what is creatinine? Creatinine, if you studied pharmacokinetics, creatinine is used طبعا from the blood samples, from the serum. You measure the concentration of the creatinine. If it is high, it means that the kidney is not working well. If it is low, it means that the kidney is working well. Okay, heart failure means there is reduction in the blood flow. Okay, يعني the heart is not able to pump the blood well to the system, including the kidneys. طبعا not pumping enough blood to the kidneys will reduce the ability of the kidney to remove toxic materials and other things. فit can actually affect creatinine. يعني there can be some kind of relation between heart failure and creatinine, but this relation is not direct. What you should be measuring is the ejection fraction, how much the heart is able to eject from the blood. This you should be your primary endpoint and not creatinine. Creatinine can be a secondary endpoint but not primary in the case of heart failure. Okay, isn't the primary endpoint is some measure or some endpoint that will answer directly the objective of the research. Secondary are other things such as severity, incidence of safety of the drug. طيب, sometimes the investigators, they think that their primary endpoint is not one thing. Okay, they have more than one thing, and here we call it composite endpoint. Composite يعني مركب, يعني we have more than one thing as a primary endpoint, and we call it composite endpoint. This composite endpoint is usually, and this is very important, pay attention, it's usually consists of clinical outcomes. هلا, you need to understand what do I mean by the term clinical outcome. Clinical outcome means things like did this occur or not? هل الهارت failure occurred or not? هل الdeath occurred or not? This is clinical outcome. Did the myocardial infarction or heart attack, did it occur or not? Stroke, did it occur or not? Did it did it remove the problem or not? Okay, we call them clinical outcomes and they are very important. Okay, بينما we have, for example, pharmacological action or laboratory parameters such as cholesterol level or blood pressure. Okay, and we consider them, we don't consider them as clinical outcome. Is a clinical outcome is something like myocardial infarction, death related to cardiovascular problems, stroke, myocardial infarction, as I told you, while cholesterol is not a clinical outcome. Okay, that's why even if a drug can reduce cholesterol, and pay attention to that, if it can reduce cholesterol, there is no guarantee it can reduce stroke, myocardial infarction, or cardiovascular related disease. Yes, there is correlation between cholesterol and these incidents. Yes, there is. Okay, but it depends on how much the drug is able to lower cholesterol. Okay, depends on that. That's why they consider cholesterol level as surrogate. Surrogate يعني بديل of the real thing. The real thing is the clinical outcome. This is more important. But sometimes, you know, it takes a lot of time to find the outcome, the clinical outcome, to see whether it is beneficial or not. That's why sometimes they go for the surrogate endpoint. طيب, now why some investigators, they say we need to have composite endpoints? The reason, the right reason, when the clinical outcomes are all important in the same way. Okay, يعني they are equally important, they have equal importance, so that's why they are putting them together. Okay, but you should be careful because there is a debate. For example, you might want to have a composite endpoint composed of stroke, myocardial infarction, angina pectoris, coronary vascular related death. Maybe you want to have them as composite endpoint. Okay, that's not a problem. But the problem is death, for example, is more dangerous than myocardial infarction or stroke or angina pectoris. Okay, maybe angina pectoris is the least, while the importance of death is more influential in my decision. If it can reduce death, it's better for me than if it can reduce angina pectoris. Yes, I want to reduce all these things, but death is more important. So if they report, okay, that drug A is able to reduce the composite endpoint than drug B, مثلا, for drug A is better, this is not enough, okay, because maybe it can reduce the angina pectoris, okay, but maybe the death is increased or it's not changed, okay. فإذا if the investigators have composite endpoint, they should also analyze the individual endpoint. Okay, is that clear? Okay. طبعا another thing which is important is that the investigator should and must report how they are going to measure the endpoint, the measurement, what is the technique that will be used, not only to use proper endpoint, but to allow the readers to know about the method that is used in measuring or determining the endpoint. Sometimes the endpoint can be judgmental. For example, I want to see whether the patients will need coronary revascularization, يعني they need to put vessels in the heart, يعني connected to the heart, and replace the old ones that are blocked, okay, or maybe stent is enough. Sometimes it depends on human judgment, and in this case we might need blinded endpoint committee, okay, a committee, or blinded, we call it clinical events committee, in order to determine whether the outcome has happened or not. Okay, what about follow-up? And when I say follow-up, it means the duration of the trial. It should be, is there like a magical number? All trials should be between 4 weeks to 8 weeks? No, there is no such thing. It depends on the aim, on the goal of the study, okay, and the events that are occurring. For example, I'll give you an example. Cholesterol level. Cholesterol level can be determined in about 6 weeks. Okay, it will give, the drug can give its maximum effect within 6 weeks. فإذا the trial should be at least 6 weeks. Okay, طبعا should not be very long. Okay, if we go to another drug which is used for the treatment of psychosis, اللي هو aripiprazole. If the investigators only tried for 4 weeks, they cannot judge if it has clinical benefits. In 4 weeks, they can only judge that if it has any pharmacological effects. فإذا, what I mean to say that there should be appropriate duration to allow adequate measurement of the endpoints and for the events to be occurring. Another thing is monitoring. Monitoring here means how often are you going to check the patient. طبعا, do I need to check the patient every day? The patient should come to the hospital every week, every month. طبعا, this monitoring should be enough. It should not be يعني exhaustive or very intensive, but at the same time it should not be with high interval that maybe something is happening and I'm not aware of that. So monitoring should be appropriate as well. It should not be extensive, and the personnel that are collecting the data should not be overwhelmed with the work that they have to do with the patients, and maybe they are not able to complete their work because they have to do every day for many patients. So you have to plan that appropriately. Also, you have to take into account that large clinical trials will need what we call a subgroup that looks at the data and monitor the data, okay, and they are blinded, okay, so they have to collect the data maybe after every 3 months or every month or every so and so, depending on, as I told you, the objective of the clinical trial and the endpoints they are trying to measure. So these members or this subgroup committee will do interim analysis. يعني every period of time they will collect whatever data is there and they will do analysis. Why? Maybe okay, the trial maybe is going to run for 10 years, but maybe after 5 years or 5.2 years, as what happened في Women's Health Initiative trial, okay, maybe the data indicates that the drug maybe is proven to be effective and safe, okay, while the placebo, those who are taking the placebo are not benefiting from the drug. So why they should continue? It's now proven within, instead of 10 years, within 5.2 years, it's proven. Or the opposite. The opposite means after 5.2 years, they found the following. شوفوا بالWomen's Health Initiative. Women's Health Initiative trial was discontinued after an average of 5.2 years of follow-up. يعني وقفوا قبل before the duration, before the follow-up is complete. Because ليش وقفوا؟ The health risk exceeded the health benefit from continuing the trial. Okay, that's why they stopped. طبعا when they do the interim يعني مرحلي, not final. Okay, when they do the interim analysis, they will find whether something is going wrong in one group or something is going good in one group. They can see that, and once they know that there is something happening, maybe wrong thing is happening, there is a protocol for them to discontinue the trial and be unblinded. يعني they will say, okay, there is something dangerous happening in group A, so we have to stop. So what is group A is taking? So we need to know that. Okay. What about compliance? Okay, we talked about follow-up, we talked about monitoring, we talked about interim analysis. What about compliance? Maybe Ala or Tulin or Tala, she's not taking the medication. How can I check that? Well, طبعا there are different ways to ensure compliance. One of these things is pill count. يعني always ask the patient to bring his pill container in order to see how much is there. Also, if the patient is doing refilling, you might ask the pharmacy or the place where he does the refilling, you can ask how many times did the patient do the refilling. Or you might be doing a serum drug concentration level. يعني you will take blood samples from the patient to make sure that the concentration of the drug is right, and it means that he's taking his medication regularly. Or you can, maybe the patient is or the patient keeps forgetting, so you might send him a message or make a telephone conversation to remind the patient taking the pills. Now we will talk about very important thing, which is sample size. sample size. هلا you cannot write a paper, okay, or you cannot do a research and you say, okay, my sample size depends on convenience, or convenient sample size. There is no such thing in science. There is no such thing as convenience. Now, what about the size? How much do I take? I have, let me first illustrate this to you by maybe drawing something to you. Okay, I will draw the following. Okay, let's say, let me take this one. Okay, let's say this is my population. Can you see the dots? This is my population. Okay, there are many. Had a population that has the inclusion and exclusion criteria. Now, from this population, I want to take a sample. Now, this sample should be representative. Okay, it should be representative. Can I take one? Will one represent the population? Will 2 represent the population? Will 100 represent the population? Will 1000 represent the population? Well, you need to know the following. The more you take, okay, the more you take, the more you are close to the value for the whole population. Yani if you take the whole population, you will get accurate results. Yani your results will be the true. Then if you take the whole population, the results will be what we call them true results. Then this is the results of whole population. طيب, but if you take sample, it has to be representative. One surely will not be representative, but to take the whole population, which might be 100,000 or 100 million, is also not practical, right? Because it will not be possible to recruit everyone. Some people might not want to join. Also, that will means that you will need to have so many nurses, so many physicians, so many hospitals, so etc., etc. It's not practical to take them on. What you need to do is take something representative. Okay, طيب, let me just to illustrate this to you, let me consider that here is your class and there are 40 students in your class. Okay, في هناك 40 students. Now I want to know their score fill quiz out of 10. Okay, out of 10, what is the score? So out of 10, what is the average? I want the average score. Is that clear? طيب, and there are 40 students here. طبعا, in order to get the true average, what do I need to do? I need to take the whole class. Okay? طيب, if I want to have representative sample, then randomly I should take some of you, okay, and take their average, and that average, if it is representative and big enough, it should be close to the true average. It should be close to the true average. لاحظوا, please pay attention that the higher the number that I take for my samples, كل ما كان number higher, okay, كل ما كان the more it is close to the true average. Okay, so that's what you need to think about when you want to do controlled clinical trial. Did they take enough number from the population of patients? Did they take enough number? in order for the results to be close to the true. Okay, now there are equations to do that. Okay, but let me just briefly here describe to you what is going to happen. Okay, if you have two groups, group A and group B, and you are measuring cholesterol levels, okay, for the two groups, and here you got it like 160, and let's see, here you have 190. Okay, can you say that they are different? See, you are taking them from the population. You are taking them from the population, and they do not include everyone in the population. So just by looking at these two numbers, I cannot judge. But let me give you another scenario. If you know that I teach two classes, okay, if I take the average of quizzes for all the students in each class, the average here is 9, the average here is 9.1. Okay, which class is better? I will go for this one directly, because 9.1 represent the whole class, it's true value, and 9 here represent the whole class, which is a true value. This is the average, this is the average. So here I'm comparing two true value. Yes, the difference is very small, it's 0.1, yes, I can say that. But is there a difference? Yes, there is a difference. Okay, طيب. When I take, شوفوا هون, this is another example. If I don't take the whole class, I just took 5 from this class and 5 from this class, and this average is 9.3 and this average is 8.4. Is there a difference? I cannot just judge directly. Okay, so this is what I need you to know. Why I cannot judge? Yes, there is a difference here in the average of the samples, but not in the average of each class. Okay, that's what you need to understand. That's why if I'm testing cholesterol level for group A and B, and I get 60 and 160 here cholesterol level, and here 190, I cannot say in the whole population A is doing better than B because cholesterol level in A is less. I cannot do that, okay, because I'm taking a sample. طيب, so how sample size is determined? طبعا there are many factors that influence the sample size that you take. Okay, في هناك many factors. I will just give you يعني just for you to understand how it's done. طيب, first of all, what difference? That's the question you need to ask yourself. What difference between A and B, okay, في population that makes sense to you? يعني if someone cholesterol level is 200, خلينا نحكي, let's see, 200, and it goes to 198, هل the 2 here is important? No, it's not important. For example, I need a reduction by 40%. Okay, this is better. This is really significant. Okay, if it is less than 40%, then maybe it's not enough. Or maybe I will make it 20%. If it is 10%, 15%, it's not good enough to me. Isn't the first thing for you to know is what difference في population between A and B, مش في sample. I'm not talking about sample. في population between A and B that sound significant to you. Okay, طب how will you know which thing sounds significant? Well, you need to have medical background, and you need to go to literature to see with every 1 unit reduction في cholesterol level what will be the reduction في death أو في myocardial fraction, etc. If you have such knowledge, then you can say what what is meant by significant reduction. Okay. طيب هذا this is one. The larger كل ما كان larger الديفرنس بين the effect of drug A and drug B, كل ما كان large difference okay في population, the larger the difference you require, the smaller is the sample size. إذن larger effect requires smaller sample size. ليش؟ It's like looking at things. If you want to look at very small thing, يعني very small effect, then you need a microscope, صح? So if you are looking at very small difference, you need a big sample to be able to look at it. If you want to look at big effect, it should be visible very well, it should be noticeable, okay? Otherwise it's not important, then you need small sample size, because small sample size can help you in that. طيب, another thing is how these numbers should be close to the true number في population. يعني if you try on the whole population, how close is this one to if you try it on the whole population? This is 160. If I take another sample now, if I take another sample, I do A and B again, A and B groups again. If I do it again, and here I look at cholesterol level, طبعا I took another sample from the population from here, okay? Here I might find 165, here 185, okay? This is very possible. So I'm talking about how close is your sample mean from the true. طبعا if you want it to be very close, it means you need larger. The larger the sample, the larger it is close to the true values. This is another thing which you need to be aware of. Okay. طيب, another thing is variability. Variability يعني if I give cholesterol drug, you know the effect of cholesterol drug among different people can be different. في variability between people. So the higher the variability between people, okay, كل ما كان ال variability is high between people in responding to the drug, we have high variability. We need high also sample size. Okay, so the higher the variability, the higher is the sample size. So I hope this quickly tells you how we do that. And before I go to this website, just to go quickly, what you need to know is the effect, the magnitude of difference between the two groups can be based on results from previous research trials. يعني if you want to see what really you want, what is the significant difference that you expect to be good and to be acceptable to market my medication, what is this difference? You can go to the previous research trials and studies to find out what is really significant to use. يعني what is the significant effect, the difference between placebo and the drug, or one drug with another drug, the difference that is meaningful, that is useful, that you can use it to convince practitioners to use your medication. Okay, you can go to previous studies and look at it. And as I told you, in general, انتبهوا, this is very important, an inverse relationship exists between the sample size and the effect size, as I told you here. شوفوا, the higher the effect, the smaller is the sample. فإذا there is invert relationship. طيب, والسامبل طبعا sample size, as I told you when we talked about the effect. طبعا here we are talking about primary endpoint. And when you want to calculate your sample size, you need to refer to the primary endpoint. In my example here, I was talking about cholesterol level. And my objective or my primary endpoint was regarding the effect of drug A على الكوليسترول on the cholesterol level. Now there are equations to calculate sample size, but fortunately there are also websites that can help you calculate the sample size, and I will take you to that. Okay, the first one اللي هو clinical C لا clincalc.com, and let me just type it here for you so you can see it. This is one. Okay, it's this one, clincalc.com/stats/sample size. Okay, and you have to first tell the calculator what you are intending to do. Are you having two groups, independent groups زي في controlled clinical trial, or you have one group and you want to compare it to the population? Your endpoint, is it a continuous type? طبعا we will talk about the types of endpoints or types of data. It can be categorical, okay, ordinal, or it can be continuous. Continuous زي الكوليسترول level, hypertension. أما dichotomous زي died or not died, had a heart attack or did not have a heart attack. كلها dichotomous. Okay, so you have to choose. طيب, in my case here, I was comparing drug A with drug B for the effect on cholesterol level. So I'm having two groups. The cholesterol is continuous. طيب شوفوا هون anticipated means. طيب I know that for drug B اللي هو الكنترول maybe or another drug, from literature or from my knowledge, okay, or from previous studies, I know that the I will get 190 كمين. شوفوا هنا بحكي لنا شو mean. Okay, for my group, okay, if it is effective, I needed to have at least 170. If it is not 170, if it is more, I don't think it is يعني good for marketing. I don't think this is very significant. Okay, and here you will need to write your standard deviation, and see here if you put the mark here, it tells you what you need to write. The anticipated mean plus standard deviation of group. Okay, طبعا how do you know standard deviation? You need to look at previous literature, or you can use what you expect. Okay, for example, according to the drug given in group 2, I expect a standard deviation of 10. And remember, the higher the standard deviation, اللي هو variability, the higher the variability, the higher is the sample size, and I will show you now. Okay, alpha, and I will talk about alpha inshallah next tutorial, is usually 0.05. The power is usually 80. Okay, هذا power is the power of the study. كل ما بدكم you want طبعا 80% is acceptable. The higher the power, the stronger is the study, but you will need more subjects. Okay, شوفوا calculate. Here it's giving me that I need 4 in group 1 and 4 in group B. طب شوفوا لما ازود الفاريابيليتي اخليها مثلا 30، شوف شو بصير. calculate. See, now I need 35 and 35. طيب شوفوا هلا 35 in each group. طيب شوفوا هون if I need this to be maximum 150 يعني بدي there is a big difference must be there to be detected. شو راح يصير بالsample size؟ it will be reduced. شوفوا هلا now I have 9 and 9. okay. طيب if I want to increase the power of study شو بصير بالsample size؟ it will increase. شوف now 85. طيب كانت 9 and 9. see now 10 and 10. okay, so these things you need to know. كمان if طبعا here in this one it's assumed or it assumes that the population is very large. okay, if the population is smaller or limited or finite, okay, مثلا as the number of pharmacists in UAE or the number of consultants, doctor physicians that are consultants in UAE, then in this case there is another website that you can use, and this is specifically when you want to do a survey. okay, it's apps.gov, government, this is very strong, .au Australia. okay, I will type it here so you can also see it. okay, so this is another website that can be used when your population is not big. زي كأنه بحكي في الكلاس, in your class you have 40. okay, you can use this one. okay, inshallah in next lecture we will talk about statistical analysis. Maybe it's getting tougher, but it's getting also more interesting to talk about these things because they are very important thing that you need to apply when you want to evaluate controlled clinical trial. You need to understand them. If the clinical trial is not calculating, they must calculate the sample size according to the endpoint. okay, if they don't do that, this will be a very big question mark. It will be a very big question mark. طبعا it's not only applied to controlled clinical trial but applied to almost anything. okay, اللي هو calculation of sample size. okay, I hope this is enough for you. Take care. You know how to you know, if you have any question, you know how to contact me by WhatsApp, email, during the classes. Take care and bye bye.